Welcome back, and thank you for tuning in to our next episode of the virtual Heart of the Business Conference. I'm Tom Jacobs, and along with my co-producers, Rita Hernandez-Figge, Jake Bartelt, and the rest of the team at MedHQ, we thank you for watching the virtual Heart of the Business Conference. We're joined by John Page, our host and discussion moderator, as well as today, Ed McConnell. Ed is the Executive Vice President for Hub International. The purpose of the Heart of Business Conference is to gather people together who are interested in topics around wellness and well-being. That is, well-being for individuals as well as for the companies and organizations for which we all work. As part of our Heart of Business Conference series, we're also collecting donations on behalf of the Metro Chicago Heart Walk. Thank you for your donations. And thank you for watching this episode of our conference. All proceeds collected from you, and we mean all proceeds, will be delivered directly to the Metro Chicago Heart Walk. This is an event created by the American Heart Association to attract community involvement as well as financial support for the AHA. In fact, MedHQ is also donating to the Heart Walk through 100% matching of your contributions, dollar for dollar. We're also fortunate to have many wonderful sponsors supporting our efforts and those of the Metro Chicago Heart Walk. Today, I'd like to especially thank LCM Capital Management for their support. In today's episode, our host, John Page, will dialogue with Ed McConnell. Ed joins us, as mentioned, from Hub International, and their topic for today is social determinants of health. With all that said, John and Ed, please take it away.
I'm John Page, here with Heart of the Business from MedHQ. And with me today is Ed McConnell. Ed is Executive Vice President for Hub International here in Chicagoland. Ed, welcome to Heart of the Business.
Thanks, John.
Tell me a little bit about yourself, Ed. How'd you get involved with Hub?
So I've been a health and welfare guru for over 15 years now. Kind of fell into insurance. And so my primary role at Hub is a health and welfare consultant. Fell into that, sort of by happenstance, sort of early on out of college, but found that I had a mind for it and a strong passion for it from the very beginning. And so I fell into it by way of, meeting an executive at United Healthcare and went to work at United Healthcare and spent about 8 years there. I actually followed him and some other executives to build out a consulting team that did accountable care organization work with Mayo Clinic. And so I spent a little bit of time with Mayo Clinic building out ACOs and some sort of population health management strategies and solutions. And got pretty tired of spending 6 days on the road. I've got 4 kids under 11. And so decided it was probably time to take a little bit more, stable local role. And so now I'm in a national role again at Hub, but I guess I don't travel 6 days a week anymore. So I've been consulting now with large employers for, a little over six and a half years.
And exactly what does a health and welfare consultant do, or the Executive Vice President for Health and Welfare?
Yeah, so, there's really no 2 days that are the same, which is probably why I like it so much. But, our main goal is to consult with employers around their employee benefits program. So, okay. Thinking about employee value proposition, how the benefits programs fit into that. And, we really cover all business insurance, so workers' compensation, those types of lines. But then when it comes to the employee-facing side, we're very heavy in 401k. And the bulk of my responsibility and my background is employee benefits. So medical, dental, life, vision, disability, critical illness, accident, sort of all voluntary lines. And then, of course, by way of that, wellness programs, population health management solutions, communication and engagement strategies, overlying or maybe overarching cost control. Making sure that we are brokering in the best interests of our clients, looking for ways to reduce cost, looking for ways to change behavior, and looking for ways to keep that employee benefits program sustainable long term.
I think a lot of people believe that healthcare insurance wants to stop you from using that health benefit. And that's probably true for episodic or, you're going to use it. But what about chronic disease? I mean, how do we want to deal most effectively with chronic disease?
Yeah, I mean, that's a huge question. Chronic disease, if you look at the spend on healthcare, we're the number one healthcare spender in the world. We'll spend $3.5 trillion on healthcare this year.
That's a T, right? Trillion?
That's a T. And so it makes up, close to 20% of our GDP.
Okay.
And climbing. I can pop up a stat here on my screen, and you can see, pretty quickly that, we are by far the biggest percent of GDP spend on healthcare of the civilized world. And so this goes through 2012. If we were going to track this forward, which is its own sort of actuarial undertaking, it looks like the United States sort of flatlined 2010 through 2012. That was more of the recession than anything. That has continued to climb, and we still have a very similar spread, against Australia, Austria, Belgium, virtually all of the civilized world.
And yet we're not necessarily the healthiest people in the world, are we?
We're not. So, if you look at the slide before you, you can see 6 in 10 adults in the U.S. have a chronic disease.
Wow.
4 in 10 adults in the U.S. have 2 or more. And we're spending, close to 65% of every dollar overall in healthcare on chronic disease. This slide counts out 75%. That includes some of the administration charges. But if you really cut that dollar down to the true number, virtually all of the money that we put into the health insurance system, that we use, whether it be through a hospital system or a primary care or a surgical center, virtually all of that money goes back into treating those with chronic disease. And obviously, that sort of manifests itself in a whole lot of ways that we can get
It's
in.
not what we all think about, the broken arm and the car accident. It's actually things like diabetes and obesity and heart disease. Is that correct?
That's true. So if we look at things like, so you're going to hear a lot of, you're going to hear the word comorbidity factors.
Okay.
From me. And so when you think about the underlying conditions, the high blood pressure, the high blood sugar, those are all comorbidity factors. They lead to things like cancer, things like aneurysm, stroke, diabetes. Diabetes is probably the most concerning, given we're seeing just absolutely huge increases in its propensity. So
Well,
we've seen
especially
it.
with younger people too, right? Because of the obesity issues.
Correct. We're now seeing the highest levels of diabetes in children that we've ever seen. And so when we're talking about that, we're really talking about type 2 diabetes. So diabetes that wasn't really genetically there, or someone that was predisposed to diabetes. We're talking about people who have, through diet and exercise or lack thereof, fell into a diabetic or pre-diabetic state.
And I know with this pandemic that has recently been identified as these comorbidity factors have been identified as a huge proportion of the deaths have comorbidity factors.
Correct. And you probably saw the CDC just released, sort of the pure COVID death number versus the underlying condition COVID death number. And it's something like 6% of the total deaths are non-comorbidity induced or had no underlying conditions, going on.
Obesity was one of those big ones too, wasn't it?
Yes.
Wow.
Yes. Obesity, diabetes, depressed individuals. Those made up the majority. And then, of course, those with advanced age who are going to naturally have more of a propensity for comorbidity.
Wow. That's distressing, isn't it? Because it leads to so many things, and potentially it is a controllable comorbidity factor that then leads to other things that just pile on each other.
Yeah. And, some other statistics, and you'll see this slide, quite often, but you can see sort of what the obesity rates and where that translates into the diabetes rate. Obesity and diabetes are tied very closely together.
Well, that looks like a red tide, doesn't it? Holy Christmas.
It does. In fact, they've had to create new heat maps, new ranges since they started measuring this.
Wow.
Back in the early 90s.
That is not a good sign, because that doesn't speak well for longevity and life expectancy, health disparities, things like that. Huge as a result of even these two issues here.
Yeah. If you look at, for instance, 2015 under obesity, greater than 26% BMI.
Wow.
Yeah. So, greater than 30 kilograms per, BMI, greater than 26% of the population. So 1 out of 4. And they're believe that, if the current trends continue, we're looking at something like 68% obesity rate of the population by 2025, according to the OECD.
That is a grim statistic there.
Yeah, and if you compare us to those other countries that I showed from a GDP perspective, we've got them beat by, somewhere in the neighborhood of 10% on these factors.
But it's a race we don't want to win, isn't it?
It is. It's absolutely it's a race to the bottom. It's costing society, and we're talking about this from an economic perspective. But when you think about the way that that affects lifestyle, the way that sort of that existence creates itself, having to constantly doctor, having to deal with comorbidity factors, that wears on a person, and there's a pretty strong statistical tie between comorbidity and health to mental health and some of the other things that go on when you have somebody who's dealing with these types of conditions.
One of our previous speakers talked about not just longevity, but being able to be active. And even though we may be living longer, we're getting to the point now where we're not really having a life, that we are existing, but we're having, end of life issues for a longer period of time. That doesn't sound fun.
No, it really is not. And if you think about sort of, the global well-being index, and you think about sort of what Gallup defines as thriving, unfortunately, because we have what is going on in this country, we oftentimes deal with sort of a less holistic existence, right? When you think about purpose, social connection, financial, community, and physical, those are the things that sort of make up someone's well-being, or how happy somebody is. Obviously very hard to measure, but you can see here that we're not anywhere in the top from highest 10 well-being countries. We're not anywhere in the bottom either, but we're certainly not where we should be, given how advanced we are as a nation, how much access we have to care, access to jobs, unemployment. If you think about our household income compared to the majority of these countries, we really should not be in the position that we are.
I know one of the things that we talk about a lot, especially here in Chicago, is the disparity between life expectancy. Do we want to talk a little bit about that? Socioeconomic issues of health and what generates from those kinds of things.
Yeah, absolutely. So, walking you sort of through that, When we think about the determinants of health, you've got genes, right? You'll hear everybody talk about biology and genes and those things, and that's real. It's believed that about 10% of your health is determined by biology,
Just
and that
10%?
just 10%.
Wow,
So
that's not at all what you would think.
it isn't, and so you can't necessarily blame it all on your parents from that perspective.
Well, you can, but it wouldn't be honest, right?
Wouldn't be honest. And so, yes, there are people who are, have a greater propensity. Heart disease, things like that are obviously, more heavily impacted by genetics than obesity and some other things. Physical environment is 10%. Clinical care is 10%. Where we start getting into numbers that really move the needle, you start talking about health behaviors, the way we live, the diet that we achieve or don't achieve, how active we are in our profession, and then the biggest slice of it you can see there is the social and economic factors. And so,
the health behaviors is something almost totally under our control, right?
Entirely under our control. What we eat, how we eat it, when we eat, why we eat. The other eat.
Side, the activity, right? That's under our control as well.
Correct. Going to the doctor, being active, all of those things play into that. And then the biggest slice of the pie is the social and economic factors. So,
what do those include?
It's mainly where you live and what you earn.
Okay.
So how readily accessible care is, and how much money you have to achieve or to enter into the healthcare system.
Well, that is illustrated here in Chicago really easily when looking at the Gold Coast versus a zip code less than 5 miles away, and that disparity.
Yeah, I think the last time I saw that statistic, it was something like a 30% difference in life expectancy rate.
About 30 years difference just in a less than 5 mile zip code change within the city of Chicago. With all of the healthcare access we have here, the world-renowned providers, and the wealth that we've got here in Chicago, and we still have this huge disparity simply because of socioeconomic factors.
Yes, and you see that also with food deserts and access to transportation. You'll have multi-generational homes, where people aren't able to necessarily take care of themselves as well as they could because they might be taking care of an elder. And so what's interesting with this is between social and economic and health, you can see that those two things alone make up 70% of how healthy you will be over your lifetime. Interesting call it. Zip code is a better predictor of health than genetic code.
Wow. That's not at all what people believe, I think. They think,
it's
gave me is what I'm stuck with.
Yeah, it's counter to what we typically think about. We typically think, genetics. That's the first thing we typically think.
That's the easy way out too, right? We don't have to take responsibility. If it's all predetermined, it's not on us.
Correct. And so when we think about this, the determinants of health, 50% are social. So 50% are traditional. So your health and wellness, so your behaviors and your clinical care. So things like tobacco use, diet and exercise, alcohol and drug use, access to care, quality of care. And then the other half are social. So it's education, it's employment, it's income, familial and social support, community safety, things like air and water quality, and then housing and transit. And so there's almost a 50-50 break between your, sort of the behavior side and then the side that it encapsulates you. So obviously the social determinants change behavior. Education, employment, income, all have an impact on your ability to navigate this system, your ability to, be healthy. Obviously someone who's educated around eating better and understands that there are impacts that are had from things like diet and exercise is likely going to have a better outcome than someone who doesn't. But it's very interesting to me that these behaviors in the clinical care make up only half of the determinants, of the modifiable determinants, right? These are things not including genes and the things we've already thrown out. We're really talking now about that 70% here. And again, a really, split down the middle between behaviors in clinical and social and physical environment.
And these are things that we can potentially, young or old, can start today, that we should be teaching our kids, educating our kids on healthy eating, on being active. Amazing to me that the percentage that is what I would call controllable.
Correct. The controllable percentage, education, employment, family and social support, those are in a lot of ways community-based type programs. Those are education opportunities that take place in school, in health, and things like that. And so a lot of that, starts in school from an education perspective and then comes back into the family setting. And if a community is behind that, then obviously the social and economic factors can start to change or at least come back up to par.
I mean, I think we believe that, we see the connection between education and financial well-being. But what I'm hearing is there's also a connection between education and everything else that stems from that for your health well-being. That is.
Yeah. There's also, I think, a degree of community acceptance. And so, if your community is active, if your community is out and, they're out of the house and engaging with each other in parks and they live in a more active area. You think of places like, somewhere as cold as Minneapolis, Minnesota, one of the more active communities in the country. They have a lower.
Really?
Yeah, they have to get out and enjoy it while they can. And then Colorado is another good example of that. So
Colorado is, in fact, you are correct. Just got back from there, and the number of mountain bikers was amazing. Everybody on a bike.
Yeah, a very active area, and so that's probably a visible example of where the social norm is an active lifestyle. There are areas of the country where the exact opposite of that is true, and so that obviously plays into upbringing, behavior, routine, and habit in a lot of ways.
Wow, that is unbelievable. Are there other social determinants to that behavior?
Yeah, I mean, so when you think about health behaviors, again, that makes up that 30%. So it's that slice of tobacco use, diet and exercise, alcohol and drug use, sexual activity falls under health behavior. And so if you think about sort of that, if you look here across the screen, you've got lifestyle behaviors, risk factors, and chronic disease. We as a health system, the most advanced health system in the world, have not been able to necessarily start to engage on the lifestyle or the risk profile of our patients. We've remained very focused on creating solutions sort of at the end of the line. When someone is so far gone that they're on dialysis already, or has such high blood pressure that they're treating it with medication as opposed to catching it early through diet and exercise. And that's just the way our health system and many health systems around the world are built. But we have probably one of the worst systems that I've seen when it comes to treating chronic after it's so far gone, not catching it early. But then also instead of the prognosis or the treatment plan being exercise, we're also the first to prescribe.
It is unbelievable to me that we are, in fact, a very episodic and acute care-based system rather than a system that looks at holistic long-term approaches. You are absolutely correct with that.
Yeah. Yeah. So we're spending very little time in lifestyle. We're not necessarily treating the underlying condition of the risk factors, those comorbidity factors like blood pressure, cholesterol, BMI, and glucose.
So we're solving the symptoms, is what you're saying.
We're solving the symptoms. Yeah,
And
in a lot of ways, causing other symptoms with the treatment.
Correct.
How many people do you run into who are on a fairly major prescription medication that's doing liver or kidney damage long term?
Wow.
And so it's only a matter of time until you take those prescriptions long enough where you've got liver failure or kidney failure to a degree.
Well, and then you've got the risk that they are interacting with each other in a way that you didn't anticipate for a person. Yeah, I'm not a big drug taker, so I am hesitant to look at that as the way I want to live my life.
Yeah. Yeah. And what's interesting here too, so the World Health Organization believes that at least 80% of all heart disease, stroke, and T2D, and over 40% of cancer is preventable.
Wow.
And so, 80% of those major costs, remember back to the chronic condition spend, the majority of that is preventable.
And I think the quality of life goes down, but what I also understand is that the major spend for your life happens in the end of your life. Not just a minor proportion, but the greatest proportion of your spend probably comes at the end of life.
Yeah, you're absolutely right. We spend, sort of more money on end of life than we do quality of life, right? So we sort of say quality of life is your responsibility. End of life goes into the system and oftentimes sort of sticks Medicare, Medicaid with the expense. And so we as a society, end up paying for that. And so, I think we would be very well served by investing, more dollars into educational programs, into education, into exercise, and hopefully through those investments, start to change the paradigm around the behaviors that are.
Are there things that typically my employer would have that I may not even be aware of that is likely to help me to overcome, to get some of that education or to get some of those things that I can control changed? Because there are behavior changes. They're going to take time. It doesn't happen overnight. But are there things that an employer package typically has?
Yeah, there are, and so that's very similar to the progression of sort of the way we thought about this stuff. There's been a fairly major paradigm shift that's occurring, probably slower than we all would like, but it's occurring nonetheless around wellness programs.
Okay.
So the wellness programs of the past, the bringing someone on site and doing just a venipuncture or a finger prick, work well in that they did identify, sort of those underlying factors that were going on. But what we found was, you'd have the occasional person that was off the charts high blood pressure that you called the ambulance on, and you had that story to tell of
Right.
how you saved somebody's life. But what we found is that the majority of the people, the ones that were sort of in a position to make a change or to engage in a healthier lifestyle, didn't. They ended up just taking that result and coming back the next year and getting the exact same result, and so on and so forth. And we found that, that didn't necessarily create ROI. Again, important to have those things and for people to know their numbers, but if they don't know their numbers and then make a change from it, it's not as valuable. And so the paradigm shift is really, moved away from a bona fide wellness program into holistic well-being. So it's from wellness to well-being, and it starts to look at things like physical, social, career, mental, financial well-being. In fact, my team has done more education around financial health than we have done on physical health this year.
Wow, really? Just because one feeds the other?
It does. Financial stress is one of the leading causes of high blood pressure, overeating, a lot of the behaviors that we've talked about, the tobacco use, the lack of diet and exercise, alcohol and drug use. A lot of that can be tied back to financial stress.
So stress factors are true and real.
Very real. If you think about sort of what what stress does, is it puts you into sort of fight or flight mode. Both are bad, but it releases hormones within your system that get you ready and prepared. And if you're constantly anxious, if you've got stress and anxiety, your pupils are dilated, your brain is sort of misfiring, you're having a harder time converting from short-term to long-term memory, and you're releasing hormones that are really meant to only be released for a very short amount of time. And so what happens is you end up doing irreversible damage to your body, primarily your cardiovascular system.
So it's ready to fight the bear, but there's no bear there.
There's no bear there. Yep. You're fighting a made-up concept of the dollar, which is important. We use that to sort of translate our work output into things that we may not be experts in building. Things like energy or consumer goods. And so it's very important that we have those things, but it's also very important to understand how to be good stewards of our money, and eventually, how to learn how to sort of be content with what you have and be able to disconnect, from social media and some of the things that have created a world where we always want more and more and more.
So moving from wellness to well-being provides a more holistic view for somebody.
It does. And so when we peel all those back, each of those really now warrants a wellness plan. So, we talk about financial health, and that's 101, 201, 301. Everything as simple as what percentage should I be saving versus spending? How much should I be spending on my car payment? How much should I be spending on my home? How do I get my credit score up, which then results in me paying less for things like home insurance, auto insurance, loans, and so on. Into physical, what is a good diet and exercise routine? How can I bring myself down from a state of anxiety, into a more relaxed, state? Social, how do I get out of the house? Anxiety will oftentimes drive us into seclusion. Social is feeling like you're a part of greater community. Studies show that people who have friendships, people who are active in their community, whether it be church or small groups or anything, are happier overall. We're built for togetherness, and people who aren't in a together type of state are less healthy. People want to feel like they're advancing their career, so career pathing and education, and making sure that people have access to secondary education or skills training. That is a big part of well-being. And then the biggest one, and I saved the best for last because it's probably the one that's making the most advancement right now, is mental health and mental wellness.
Okay. Especially in the last few months, we've taken a hit because we are isolated and we are fearful because of the unknown.
We have. We've probably never been more anxious. We've probably never been more divided, at least in recent history. There's a lot of uncertainty being created with, people, not necessarily going back into work at the office. They're seeing their favorite restaurants shut down. They likely have friends or loved ones who are out of work. All of that plays into mental health. And mental health, it really hasn't been that long since it was considered an actual health diagnosis. And so, one, it's probably still not that well understood. Two, it's probably not that well accepted. But I think we've made huge strides in pushing for both of those things to change.
Much less stigma attached than there used to be, but there is still something there. And none of those things, none of those 5 determinants really happen on their own. You actually have to want to do these things in order for, you have to have that as a purpose in life. I want to get financially better at what I do, which allow me to become physically better at what I do, and become more social, go out and want to have friends and want to go out with friends. All of that happens because you choose for it to happen.
Correct. Correct. And I think a lot of, you know, good, bad, or indifferent, I think you have to recognize that the problem exists. I think a lot of the underlying sort of drivers of our society pull away from a lot of this stuff, right? You know, we work so many hours that by the end of the day, we're too exhausted to work out.
Absolutely.
We have a sedentary lifestyle. We're not getting up and moving. We're exhausted from work or whatever stress is weighing on us, that it maybe feels like more of a chore to go out and socialize in the way that we used to.
I have to laugh because I actually have to put it in my calendar to force myself to do it. If I'm going to go to a yoga class, I actually have to plan around it. Otherwise, I will always have an excuse why I'm too tired, I'm too cold, I'm too hot. There's some reason why I'm not going to do it, because it's not easy.
Yeah. And John, I'm the same way. I'd be a hypocrite if I said, well, sometimes by the end of the day, the last thing I want to do is go turn on, Beachbody and lift weights or something. But I know it's important, right? I know that long term, if I do these things, if I live my life, in an active way, if I have the discipline necessary, to sort of fill all these buckets of well-being, I'm going to be happier. I'm going to have a better quality of life longer. But unfortunately, we put off all these things for so long that we come, at some point, we come to the point of no return, and we're back in the chronic condition treatment phase of life. And so
we are creatures of habit as humans, and that is correct. We fall back into those bad habits.
Yes. So, you asked in the beginning what I spend my time doing. It's putting programs and plans together around these determinants of health. We've gotten very prescriptive when we think about sort of how someone interacts with an employer. So we look at that first year of service. We look at years 2 and beyond. We look at age group. We know each of these populations is sort of looking for a different way to engage. And then we reverse engineer well-being and education and all kinds of ways to build that engagement with the population, because there is not just a one-size-fits-all. When you think about employer groups, you've got every one of these populations represented.
Absolutely, you're right.
So you've got to have a wellness program or a well-being program that speaks to someone who's 65 on year 35 in their career, just as much as you need to have a program that speaks to someone who's 20 in year number 1. And so for the first time ever, we've got 4 generations and 5 generations in the workforce.
That is and increasing, because we've got more and more folks in different age groups as we continue to work longer, perhaps have younger people. And I'm getting to the point where doing something is better than doing nothing. Taking a walk is better than going for a run, although I've never been a runner. But you recognize you can't do in your 60s what you could do in your 20s, and you shouldn't compare yourself to that group, because you're not going to do anything then.
Correct. It's really about getting out there, being active. As an employer, it's about providing just a whole plethora of tools and resources for your population, and then figuring out a way that's going to, communicate with that population effectively so that they know where to go when they do decide it's time to make a change.
Absolutely. Where can I go for more information? Is it typically my HR department that has that information about what programs and services, my employer might have?
Correct. Yep. HR would house the majority of that program, or at least be able to provide a reference to where it is stored within your organization. We're moving into sort of a digital environment. I think we're moving away from that sort of print off the benefit guide and put this in the top drawer of your desk and reference it when you need it. I always use the example, my kids aren't memorizing bold-faced words in biology anymore. They're really being taught how to find information that's credible quickly.
Right.
And so, we're definitely more of a pull information society now than a push information society. And so the way we communicate now with the multi generations around the whole plethora of tools and resources that are available is we put them in one place. We teach them where to go, where that place exists, and then we make it Google searchable because that's the way we really look up information nowadays.
Absolutely. You want a good repository, and it makes it so much easier. We are an instant access society these days.
Yes.
And and I know we're doing this for the Heart Association, but heart.org is a great opportunity.
Wonderful.
For one source for recipes and other kinds of information about health and wellness and eating better. But there's also that financial piece that we need to look at and people need to be aware of and see the interactions.
Correct. And so it all exists out there. And I think, if there's one good thing about, it's probably been a little doom and gloom with, looking at our heat maps for comorbidity and obesity and looking at our spend. But I think the good news is for the first time, ever, I believe, and I'll say within the last 5 years, I think that the technology now exists to identify comorbidity factors earlier, to engage with people in a way that's meaningful to them, to provide tools and resources, much earlier, much before someone turns chronic, to engage with them in a meaningful way, to bring a more holistic approach to not only the way care gets delivered, but well-being. And so, the silver lining to all of this is we know who these people are, and we understand how to engage with them better than we ever have. And there's more research and probably less stigma around, a lot of the aspects of well-being. Mental health is a great example of that. And so, I think we're at a position now, or at a precipice now, where, we can engage in a more meaningful way earlier on, through a physician or an accountable care organization. And you're seeing sort of all of the spend and all of the reimbursements sort of now align with performance. And so I think we understand as a society that something needs to change. And I think the technology and information and approach is now starting to sort of, change and align with what we're looking to accomplish long term.
And the first step to that is, just like Nike says, just do it, right? Get out there.
Do something. Put it out, build it, and they will come. So, teach people where to go, provide the resources, be there when they're ready to make these changes, and hopefully support areas that don't have the same privilege and access with access to these tools and resources. Food deserts should not exist in America.
Not in this country, correct.
They just should not. Access to good quality care or lack thereof should not exist anymore. And so, a lot of what we do is try to put together programs that are going to, sort of, bridge that gap.
And a lot of these things people can do on their own. I mean, getting out, you don't need a gym membership. You don't need to spend a dime. a pair of gym shoes, a pair of sneakers, as I would call them in the old days, sneakers, and a sidewalk is a good walking track.
Yeah, you're absolutely right. And you have to take that first step. And you remember back, the behavior is a big piece of this.
Yes.
Behavior is a really big piece of this.
I mean, that was 30%, right?
It was.
That's a huge chunk. And 3 times as much as what grandpa gave me, right? I can blame my genes, but at the end of the day, if I want to fit into those smaller genes today, I've got to take it upon myself, change my behaviors.
Correct. As employers, I think we can put a program together that supports that, or in some ways creates a catalyst for that behavior to change. But yes, this stuff is preventable. Genes are only a small piece of it. And at the end of the day, we shall be thinking about long-term quality of life.
Absolutely, because we want to live until we die. We don't want to be, in a situation where we are alive but not able to do anything. I want to be walking up that mountain, at the time of my death. I want to fall asleep and never wake up when I'm 97 and healthy.
Yes.
And they look at me and they go, gee, he's a active 97-year-old.
Yes, exactly. Yep. And by doing these things now, that's gonna greatly improve your chances of achieving that.
Well, Ed, you have encouraged me. I'm going to take that next step today. I'm going to go out, walk my dog. I keep saying that every time, and she's very happy to be sleeping on the floor, but I notice it's not raining, so time to go out for a walk.
There you go.
Appreciate it, Ed. Ed McConnell, Executive Vice President, Hub International, here in wonderful Chicagoland. Thank you for joining me today on Heart of the Business. Thank you, MedHQ, for making this possible. And Ed, I appreciate it. Thanks for all your great information.
Thank you, John. Have a good day.
Take care.
Bye-bye.